My name is Mr. Allen. I'm a consultant orthopedic surgeon, and in this video I'll explain to you how the virtual fracture clinic works. The virtual fracture clinic is a safe, efficient way of getting a senior orthopedic review from a consultant orthopedic surgeon of an injury that's been seen in the last 24-48 hours in accident emergency departments or minor injuries units within the local geographical area. When the patient is seen in accident emergency, for example, they'll have a history taken and an examination, and then an investigation and a treatment implemented. What then happens is that clinician, doctor or nurse, has access to an electronic system where they upload patient details. Once that's done, the virtual fracture clinic, which occurs on a daily basis, picks up that patient electronically. They'll look through the history of the patient, and using the information, they'll then look through the imaging and confirm or say there is a different diagnosis, look at the treatment that's been carried out and make sure it's appropriate, and then based on that treatment there'll be an outcome. Outcomes are, one, perhaps the most important, is what's called an urgent recall. So I've looked at the clinical information, the imaging, and decided that actually you've had a plaster, for example, but what you really need is to be reviewed to see whether or not you need, for example, another intervention such as an operation earlier. The next outcome would be a referral to a fracture clinic, and because we'll look at the diagnosis and decide whether you need to be seen within 24 hours, 5 days, 7 weeks, and arrange the appropriate appointment for you to be seen in the appropriate clinic. The next outcome is we may decide that you don't actually need to come to fracture clinic. What you really need is physiotherapy. Another outcome, which occurs approximately 25 to 30% of patients, is when you're discharged. What that means is that you don't need to be seeing them in clinic. But those patients, as a safety net, will also have the potential to phone back or get back in contact with us and have easy access to the clinic if something goes awry, or if they don't understand, or they've not recovered along the expected path. Patients like the idea that they're getting an expert opinion within 24 hours. They find that the information we provide them in the phone call and pro formas, particularly patients discharged, are informative. They also like the idea that the clinics are less busy, so they get to see the consultants within the time usually that they're allocated, and overall satisfaction rates are above 90%.
This is a 45-year-old teacher who had a fall.
Does she have any other injuries?
No other injuries. No other injuries actually. She's okay.
And what's the range of movement in the elbow?
It's actually she can move the elbow 45 to 90 degree, and pronation and supination she has got a bit of pain.
Okay, but it's complete pronation and supination?
Yes, it's complete pronation and supination.
Good. What treatment has she had?
She had placed in a sling, and she's been asked to exercise with it.
Okay, fine. Hopefully we've been able to show you how the virtual fracture clinic works. But just to finish, I just wanted to assure you about the safety of the virtual fracture clinic. If at any point during the journey, whether you're seen or not being seen, if you need access to the virtual fracture clinic, we're here and there is a helpline available for you.